Welcome to The Backstory. I'm your host, Anne Hancock Toomey. Over the course of my career, I've had the privilege to work with and learn from and guide some incredible leaders, mostly in healthcare, but not always. The Backstory is a chance for me to talk to some of them, unpack who they are and where they came from, and how it all influences who they are today and how they lead. Ultimately, each conversation offers a case study in what I'm calling authentic leadership. Let me now invite you into our conversation for the real backstory. Today, I have the great pleasure of spending time with Ton-Quinlivan, CEO of Futuro Health and longtime expert and leader in the realm of workforce development, most recently in healthcare. Welcome to the podcast, Vaughn. It's really great to be with you.
I'm delighted to be here, Anne.
I'm a little intimidated talking to a seasoned podcaster like you. You're going to have to give me some tips along the way. I will gladly accept them. I think out of the gate, we got to do a quick commercial break because you have a fantastic podcast that I guess you've been doing this now for the better part of 3 years. Tell our listeners about your podcast, Workforce RX.
Yes, it's a great way to start the morning to play one of these Workforce RX podcasts, which is available through any medium in which you listen to podcasts. And I have the opportunity to meet leaders who are thinking hard about innovations and how do we future-proof the workforce and the future of work, the future of learning, and the future of care. Do check it out if you have a chance.
Well, I think it's fantastic. I really enjoyed listening to several of your episodes, and it will now be on my regular rotation. And of course, there's no issue more important in healthcare today than the development and the nurturing of workforce. Vaughn, I don't know that 40 minutes is going to be enough time to adequately cover your incredible life and career spanning education and government and healthcare and entrepreneurship, but I am delighted to try and touch on all of it. You know, when I launched this podcast about dynamic leaders who we admire, who lead with authenticity, I heard from several people that I absolutely had to interview you, that I had to spend time with you. One of your colleagues said that your passion for what you care about is palpable, that no one is more dedicated or more engaged than you, that you are a thinker and a doer, that you inspire people because of who you are and how you lead. How does that make you feel?
It's such an honor to be here, and thank you for that descriptor. All of us have our superpowers that get unleashed when we're working on the right issues, and what's core to me is when I'm working on issues that unlock opportunities for others, like workforce development, it does unlock my superpower to be able to rethink and do bold design thinking or be able to review systems and processes that don't make sense, that no longer make sense,
right.
Or to just be fierce in terms of being able to go out and build coalitions of the willing and put together unusual allies. So all of these things happen when we're working on an issue or in a domain that is true to ourselves.
Yes, that is very true. And I would love to talk about how you discovered your superpower, because we aren't born knowing what we're meant to do on this earth. Some of us discover it earlier than others, but how lucky we are to get to learn from your life and your work experience. You've got an incredible backstory. So I'd love to dig in with you and start from the beginning. So I know that you largely grew up in Hawaii, but you were born in Vietnam in a tumultuous, war-torn era. Tell me about your childhood and your family's journey.
I was born in Vietnam, and in 1975, my family escaped from the Vietnam War and came to the United States. And my father, back in Vietnam, was a neurosurgeon, a very difficult occupation. And then my mother was a teacher, and in Vietnam, that's a very honored profession. Mm-hmm. And when we came over from the war, everybody had to restart. And so my father had to redo his residency. My mother took on a bookkeeping job to make ends meet. And interestingly enough, they were never bitter about their situation and never had regrets. Instead, they were really just grateful for the opportunity to restart in the United States. And so I carry a lot of those values with me. And as I look at my career, this role as CEO of Futuro Health and our nonprofit mission to address the critical shortage in healthcare workers But also my last role, which was Executive Vice Chancellor of the largest system of higher education in the country, which is the California Community Colleges. Both of those roles have been about paying forward opportunities to others so that others also have the opportunity to take advantage of education and improve their economic situation.
Those seeds were planted in you early by your parents and their experience and how they reacted to their circumstances. Did you grow up in a large family?
When we came over, I was the age of 6, and I had an 8-year-old sister and a 4-year-old sister. And then my brother was born about 11 years later here in the United States.
And what was it like to grow up in Hawaii?
Hawaii is a great melting pot. And to be frank, I was a product of English as a second language. Mm-hmm. I was a product of food stamp and lunch tokens, which is where we got our starts.
Yeah, well, and it all starts somewhere. And so I'd love to know what was your first job? And what is something you learned from that?
I'm sure I'm not the only one who had a start at a fast food restaurant. And back at that time, it was actually Arby's restaurant.
Okay.
Interestingly enough, the manager said, "How is it that every day your cash register always closed perfectly down to the penny?" I have to say some of the math skills were very helpful in terms of being a cashier. You know, like with every job, it's about building up stamina to do good work, right? Yes. And especially if you could do the work well the first time around instead of doing rework, that's always better.
Absolutely. Tell me about the first leader that you can remember who really impacted you positively. Or it doesn't have to be the first one, but who comes to mind that has shaped you in ways that you carry with you today?
Yes. So I would say I've had many mentors over my career, and I think we'll all benefit from pulling out what they do best and figuring out what combination should influence us. Yeah. But I'd love to give recognition to Peter Darby, and I actually worked for him twice. The first time when I first came out of graduate school, and then the second time when he invited me back to be his right hand when he was CFO of a major utility company of 20,000 men and women. Mm-hmm. And he had invited me and said, there's many ways for you to have the impact that you want to have, which opened my mind to the possibility. And so, interestingly enough, after 1 year of working in that role and really having a bird's eye view of the company, every area of the operations, I came to him. And this was a time when the whole industry across the United States was aging. So 25 to 50% of its workforce was facing retirement. And the field was trying its best to hire reliable, quality, and diverse talent, and they were really struggling. For example, HR would go out in the community, they would administer the pre-employment tests, and in a room of maybe 30 applicants, only one would pass the employment exam. And that was before the drug test and before the background test. So they were making efforts, but it wasn't yielding fruit. And so putting together all of the things that I knew, I went to him and I said, I have a one-page plan. There's a better way for us to do this. There were so many communities who would love these good jobs, but they can't find their way to these good jobs, right? So the demand was out there. These jobs were in need, and yet the two weren't finding each other. And so I said to Peter, I said, here's my one-page plan. I'd like to show the company how else we could do workforce development. And so he agreed, and the CHRO agreed. And that's when I went from the 29th floor with all of its amenities and joined HR in order to do this work. And it was myself, and I was given 2 other staff to work with, and that was the beginning of workforce development. And just fast forward, we went from a situation where the company had no opinion in workforce development, and in about 2.5 years later, we became a nationally recognized industry best practice.
That is phenomenal. That was when you were with Pacific Gas and Electric, is that right?
That's right.
Okay, very good. I'm gonna rewind just a minute, if we could. So I know that you went to Georgetown and then, of course, later to Stanford for grad school. What did you study at Georgetown? And did you know at that point in time what you wanted to pursue for a career? Or was it really through that experience at Pacific Gas and Electric that you discovered this love and passion for workforce development?
Oh, and I wish I could say that I knew it all back then, but no, like everyone else, I had to fumble around a little bit. I did study business back at Georgetown,
Yeah.
but I had to try out several careers, several industries before I really found my calling. I actually started in the tech sector.
Oh, okay.
Yes, tech and telecom sector. And then after several years of working in that sector, what I found was that in my off hours, right, when you're sitting on the couch and what do you pick up? Well, I was picking up magazines that were not about technology, but I was actually reading about education and education policy in my off hours. And so I thought, I really need to figure out how to marry my avocation with my vocation.
Oh, I love that.
Right. And it's because the two were very different and distinct at that point. So I went on a journey myself to read about the possibilities, to talk about the possibilities, to interview others about what they did. And then I volunteered for some projects, pro bono projects. And then over time, it became clearer the space that I wanted to work in. And I had a friend who said, "Oh, Vaughn, I'm so tired of you talking about education. Why don't you come into the classroom and try it out?" So he was teaching at a community college. And so I went in to teach Introduction of Business. I had a class of 50, and there were only 5 white faces out of the 50. This was at a time when nobody cared about the community college as in higher education policy, because when I was at Stanford Business School, I also did a dual degree in education policy. And it was interesting that we had never touched on that topic. So when I went into the classroom, I realized this is where the future of the workforce is going to come from. And so I'm going to spend the time to see how I can make a positive difference in this tier of education. And so it turns out we often focus on the 4-year level, but there's so many occupations. As a matter of fact, 65% of the healthcare workforce are the allied health roles, and most of them are created at less than a bachelor's degree, right? Certificates and associate's degrees, and yet there wasn't visibility to that tier of education back then. So it gave me time to begin to research, have the conversation, and really spend some time to see what moved workforce development. And that was a good background because eventually I was appointed by the governor after doing workforce development in the private sector, appointed by the state governor to drive the workforce mission of the California community colleges.
Wow. Talk about that, because was that really your first exposure to kind of working in the political realm?
Yes, very much so. I was appointed by the governor to drive the workforce mission of the California community colleges, and I came in at the worst of time. I mean, it was a down economy. And so we had about $100 million in funding to deliver on workforce programs that were needed by the state and needed by regional economies. But it's tough to get things done when there isn't the funding to support that.
Right.
Part of me wondered, oh, what was I doing? I was walking away from a great private sector role, and yet I felt this compulsion to go and bring some of those private sector skills into the public sector in order to improve opportunity for others. I began the work to look at how do we begin to build more workforce programs that were responsive to the needs of employers. And the governor asked me, could you take 2 apprenticeship programs and consolidate it into one? And I said yes. And then the state added more money, asked me to integrate 2 systems of adult education into one. And I said yes. And then the state added more money. And then I proposed that since no one institution can solve all the workforce problems of employers by themselves, could we approach addressing the workforce shortages by region rather than locally? And so the governor added more money. So we went from $100 million to $200 million to $700 million to over $1 billion during the 8 years. And really, we went from having workforce as an afterthought to becoming a state policy priority.
Wow. That's incredible. And that's a very different environment in which to work, obviously coming from the private sector to the public sector. Such meaningful work, incredible success story. What did you learn about yourself as a leader through that process and being able to unlock what you were able to unlock?
I learned that I was actually good at coalition building and bringing different stakeholders together to work on a common agenda. And that somewhat surprised me. But it wasn't because it's by choice, but it's because I had to, because it was a system. It's one thing if you have authority to hire and fire, right? Yeah. But in that system, I had to get the work done, but I didn't have authority to hire and fire anyone in the local colleges. So I had to get things done through influence, which is very interesting because it makes you deploy different types of skill sets, right? It's more about building coalitions of the willing. Mm-hmm. And I think all of those skill sets also are helpful in the private sector, especially with large, diffuse organizations.
Mm-hmm. Absolutely. So let's fast forward out of the public sector. You decided to be an entrepreneur and to found this incredible organization, Futuro Health, which, of course, is a nonprofit organization with a very clear mission to improve the health and the wealth of communities by growing the largest network of allied healthcare workers in the nation. Tell me about the origins, the impetus. How did it come together?
This was a very difficult personal decision because I had stepped off 2 terms with the community colleges and then was taking a breather. There was just a range of opportunities were available. And when I was approached by Kaiser Permanente and its partners about addressing and growing the next generation of this allied health workforce, I thought, wow, is it a crazy career move to go and build a startup? But again, it comes back down to your values and what you care about. And I thought this is an incredible opportunity to take all the best practices that I've learned from the private sector, from the public sector, and now the nonprofit sector. How can we combine them differently? And so the tasks that we were given by Kaiser and his partners were help the industry, right? It was not just to create a reliable, quality, and diverse workforce pipeline, but also to do it at scale. Because in just the state of California alone, which is where we got our start, the numbers were huge. 500,000 allied health workers were needed.
Wow.
You know, when we received the initial commitment from Kaiser of $130 million, that amount of capital allowed us to become an accredited institution if we wanted to. But following that route, we would only be able to serve 25, 50, 100 students at a time. We needed to be able to operate at thousands at a time. And so we set about showing that it was possible by building an ecosystem of education partners so that we could get to that volume, but also adding some signature activities like human touch healthcare, which all employers complain about the soft skills, interpersonal skills of workers. And we really created some unique coursework so that adult learners can really practice the 6 skills essential for healthcare. Again, fast forward, we've been able to put thousands and thousands in local communities through, and we're really proud of the statistics that across all of those programs, whether it's medical assistant, pharmacy tech, phlebotomist, sterile processing tech, it's 84% diversity and 52% ethnic diversity, and average age is 31. You know, as you know, good health outcomes, health equity begins when you can have that type of workforce that reflects the communities that we serve.
Well, it's a worthy mission, to be sure. I'm curious, Vaughn, as you think back about those early days of founding Futuro Health, what were some of the challenges that you faced as an entrepreneur for the first time? I know you were well capitalized, right? But you had a very big mandate. And I'm just curious, what did you learn about yourself in that season?
And we actually launched 3 months ahead of the pandemic. And so timing is everything, right?
Oh, no.
Yeah,
Wow.
So if we had launched 3 months later, it didn't matter how much capital we had, everybody would have been heads down and distracted. Timing was everything. And what's the key behind our capabilities is we have strong expertise in workforce development. We have strong expertise in healthcare, especially how to create the pathway and the curriculum and working with education providers. And then to enable the scale is we have really strong data science technologists who are building the tools that enable the scholars, the community, the education providers, all and the employers all to work together in this ecosystem in order to grow talent. One of the misgivings or the misunderstandings of employers, providers, when they look at the workforce situation is that they have to do it all alone.
Yeah.
But the truth in workforce development is that it's a team sport. To bring together the collaboration and each bringing their own resources and doing what they do best, that's the key to workforce development. And it's a good reminder that working together, you can actually go from a situation where you have a talent puddle into creating actually a talent pool.
Oh, I love that. That's a great visual, a great analogy. So as I look back, or as you look back on your career, this is a podcast, of course, about authenticity, authentic leadership. And the truly authentic leaders are willing to admit their mistakes and their vulnerabilities and to create an environment where others are encouraged to take risks and to make mistakes and learn from them as well. And I know you're that kind of leader. Are there any mistakes that you can recall along your career that you just grew a lot from?
Oh my goodness, so many mistakes or learnings along the way. I would say a key one was I was finding myself frustrated because I would get to a certain level and then I would cap out. But I had the benefit of being part of an executive development program back in my early 30s. It was the International Women's Forum. It was for mid-career individuals. Were selected and were put through a development process. But we stayed together. So every year we would get together and we would stay together and we would update each other on what was going on with work and as well as a personal life. And interestingly enough, that group developed somewhat of a longitudinal view of each person.
Yeah.
Because we talked every year. And so once I shared what was going on with me, someone said, "Hey, you did exactly that in a prior role." It just clicked. That feedback, it was harsh feedback, but it just clicked. And so what I did after that was I found an executive coach who helped me develop some alternative ways to interact when I was in that similar situation. And incredibly enough, once I unlocked that, my career just went right up. So it was something that we all have behaviors that slow us down. And it was thanks to having a trusted group who could put a mirror in front of me and talk straight with me that I was able to figure out, oh, this is what's going on. And then I was able to figure out, bring some help in and some coaching in.
I love that. I think it's so important to have a village of people that you grow up with in your professional career who can talk straight to you, can be a bit of a mirror, right, to share with you or illuminate your blind spots and call them out lovingly so that you can actually do something about them. I love that story very much. Okay, well, the opposite question is, as you look back on your career, which I know you have much more to accomplish, but as you look back on what you have accomplished today, what are you most proud of?
What am I most proud of? I'm so proud of the work that's being done here at Futuro Health because we really took a concept and a challenge on and was able to take an idea into reality that is touching and transforming so many lives. Like Tamika, who's a security guard, and her mother had cancer. And so she spent some time taking care of her mother and then realized maybe I like being a caregiver. And so when she found our flyer, she became a phlebotomist and so now is in healthcare. Or Justin, who got laid off during the pandemic. He was thinking about becoming a nurse, but he was working in a ramen noodle shop trying to save money. So someone told him about Futuro Health. We put him on an education journey to become a medical assistant. And now he is a medical assistant. He's still pursuing a nurse, but now we have him in healthcare. Those are really powerful stories, and they are why we come together to do the work.
Yeah, that's incredible impact. Okay, before we talk more about leadership, I'd love to talk a little bit about your family. I know you're married, you have a couple of children. Tell me a little bit about your family that I know you're so proud of.
And I'm about to empty nest. This is an important week for me because my older son has packed up his car and is heading out to Wisconsin to work at actually Epic. He's starting in his first journey out of college. And my youngest is heading off to college.
I'm not quite there yet, but I can imagine that that is a big milestone. How are you feeling about that?
I am, it doesn't matter what kind of professional development you get put through, but no one has a playbook or has a course about having your career and also having a healthy family or having a healthy relationship. And I think those are all the unwritten rules of a good life. So again, I think this is one where the tribal knowledge of having a group of trusted peers, whether they come from an executive development program or some other source, to be able to see ahead at people's lives and all the cycles of business, but also the cycles of personal life.
Yes.
And figuring out what you want for yourself. Those are the insights that's a real treasure, because I've seen executives where the work is fantastic, but it's at the cost of the family, right?
Yes. Yep.
But then there are also trade-offs in the other direction. And one of the hardest conversations that I had to have was about relocating from the San Francisco area to the Sacramento area for that big job with the governor.
Yeah.
Because my husband had to uproot himself and his career, much less the family, and how to have that conversation. So these are the things that you don't get from going to any executive training program, but that's why it's really helpful just to have a peer network that you can test some of these conversations with and get some ideas of how they've navigated.
Yes, absolutely. Do you have any advice for those who are trying to figure out how to juggle the competing priorities of career and family and other important dimensions of our lives?
Several wise people have shared with me, and they were later on in life. They said, you can have everything, but you just can't have it all at once. And some sequences matter more than others. And so I think it's all about pacing and making good decisions in the moment. But being able to look ahead and say, do I want that for myself? All of that helps.
Yes, absolutely. Okay, well, back to leadership. Tell me, as you think about a leader that you admire in your career, how would you boil it down for us? What are the 2 or 3 characteristics of the most effective leaders in your mind?
I think about Betty Steiger, who touched me early in my career and my life. Clearly a very positive individual, and she had headed up Xerox PARC and a whole innovation engine of Silicon Valley in the prior days in her generation. One of the great advice she gave to me was, you need to be willing to give up who you are to become the person who you could be. And that was such interesting advice. Like, I had to really think about, what did she mean by that, right? And how I began to interpret was, I had carried a lot of my own baggage about what we all have expectations of our parents, for example, or communities of who we should be, right? Yep. And to be able to shed some of that so that we can go be our best and highest self is really important. So I actually had to forgive myself and say, it's okay for me not to be great in these other domains, because where my best and highest use is really in unlocking opportunities for others and doing big systems work. And she gave me such good advice, and frankly, it was also unsolicited advice. So many mentors along the way that I have appreciated.
I love that. So Vaughn, tell me what makes you most effective. I've heard a lot, and I think I could probably share with you my observations. But as you think about leading the ever-growing team and organization at Futuro Health, and certainly the other stops along the way, why do people want to follow you? Why do you get the best out of those who work with you and for you?
It's a really good question, and especially these days when we have such distributed teams and we're all virtual and we're all worried about culture, right? And I think this is one where I have to go back to the why, right? The why that compels us to do this work, and how to use the why, or how to be in touch with the why as a reason why we all come together to do this work together. In one way, you can call it coalition building, but another way to talk about it is just that we are to be in touch with why the work matters and enabling others to have the opportunity to do what matters. I think that's probably really my reason to be as a leader.
You've brought up a real challenge that leaders are facing today post-pandemic. I know we face it here at Girard. In 2019, we had a team that was based in 2 locations, in Nashville and in Chicago. Today, we're in 22 states. Our workforce is all over the place. And so how do you connect and how do you proliferate culture and how do you engage and create an environment that is sticky, that people want to continue to reinvest themselves in? And what you stated about the tie that binds, it all comes back. It all comes back to, purpose and mission and what it is we're trying to do together, no matter where we are, how we connect to each other and to the work. It's a beautiful gift that you have. Is there a clear challenge for you in how you lead that you're working on today?
Ooh, and it's a good problem to have. It's a good challenge to have right now, which is we're in expansion mode, and many are inviting us to bring our solutions into their community. We're like everybody else who's in expansion mode. We're rethinking our infrastructure. We're thinking our talent. We're rethinking our org structure. All the above, such that how can we bring the solution so that many more communities can address their workforce challenges in allied health. It would be so amazing if we could take all of the best practices that we have uncovered, take those best practices and those solutions to help more communities and employers.
Yes. Well, that is a challenge, but it is a good problem to have.
It's a good problem to have.
Yes, I love it. What does that mean for you as the leader? How do you think about that? How do you think about guiding your leadership team, the organization to really pursue that?
When I think about how we grow, I'm sure these are the same lessons that other leaders wrestle with. It's about building the capacity of my direct leadership bench, but also the bench below them, to be able to push as much problem solving or design thinking to each tier so that they're able to solve problems with each other or individually as these issues come up. And so it's building their confidence in being able to make decisions or being able to look at a situation. And so I also view my role as facilitating that development. And sometimes that is bringing in coaches or other experts who have experienced something similar. And so that there's a sounding board for us as we're evolving and and figuring what to do. It's also being able to connect my leaders with a safe, trusted place where they can hear, for example, other companies and how they wrestle with innovation and how they structure the organizations to be able to ingest an innovation and to scale an innovation. So all of those are learnings. And I do thrive being able to hear about how others do things, often come up with the good ideas myself when I hear about other ways to do things. And I hope that I'm able to facilitate that for my team as well.
Very good. Well, Vaughn, we are going to move into lightning round, which is a quick series of questions and either ors. I want your gut. I don't want you to overthink it.
Me.
We'll see. We'll see. Okay, are you ready?
Ready.
Okay. What is your healthiest habit?
Every morning, because it's nice and quiet, I take a walk, and usually with my spouse, over to coffee. So it's 1.5 miles each way, and that's my meditative moment to get ready for the day.
That's wonderful. Okay, opposite. What is your guilty pleasure when you need a break from work?
Ooh, guilty pleasure. I think I'm in the group that power watches Netflix. So if there's a good series, I can't help myself.
All right. What is the book that you are reading now?
My good friend Ryan Craig, who wrote Apprentice Nation. Highly recommend that.
Apprentice Nation. And what is the best book that you've read on leadership?
Oh my gosh. Colin's book, From Good to Great.
Good to Great. That's a good one. Okay, when is the last time that you tried something new?
Oh, and I've been pushing myself to try something new where it would make me uncomfortable. So I was looking for something that had a little exercise, but also put me in touch with my roots in music, because I had 12 years of piano and I lost all those skill sets. So I actually took up drumming. I went to take taiko drumming, which is a Japanese form of drumming, recently.
Oh, wow.
And that was really fun.
That's like full body drumming, right?
Yes, that's right. It was something new, something that I wouldn't be good at, but really it was just so much fun to really push yourself out of your comfort zone.
So are you going to take it on the road? Are you going to be performing at a park near you? What?
Stay tuned. It might take a while before I can get good enough to perform.
I love it. Okay. What is a piece of advice that you would give your younger self?
Oh, I would, gosh, why is that so hard? Oh, I got it. So my younger self took feedback not as well as my older self. The thing to do, this is actually what I tell younger people starting in the career. Listen to the feedback and then say thank you.
Very good advice. Well, Vaughn, that is the end of Lightning Round and near the end of our time together. What should I have asked? Do you have anything more you'd like to share?
A little bit of a plug and a little bit of a point of pride. Futuro Health, even though we were launched in 2020, I'm really proud that our solution has been featured by the National Governors Association, by the Center for Medicare and Medicaid Services, and the World Health Organization. So last year, I was in Geneva as part of the panel to share the solution, because the issues that we face in the U.S. in healthcare is not unique to us. This is a global issue.
It sure is. Well, that is something to be proud of, and I cannot wait to continue to follow your journey as CEO of Futuro Health and the incredible growth that you all, I know, inevitably will be pursuing and the impact that you will have. And I just want to say thank you for the time today and for the opportunity to just get to hear a little bit about your backstory and the kind of leader that you are and the experiences and lessons learned along the way. You've been very generous. Thank you, Vaughn.
And I don't get to talk about these topics very often, so it's really refreshing. Thank you very much for doing this podcast.
Absolutely. Have a good day.